Filipino nurses have been on the front lines of the healthcare system, not just here at home, but in many other countries, including the United States. Here to tell us more about America's relationship with Filipino nurses is Health Carousel Chief Operating Officer, Erik Schumann. Erik, thank you so much for joining us on The Final Word. So tell us, how important are Filipinos to the U.S. healthcare infrastructure?
Rico, first, thanks for having me on the show. It's great to be here in the Philippines. And, the Philippine nurses are vital to the healthcare environment in the U.S. They provide, exceptional care to the patients, compassionate care at the bedside, and really critical to ensure that every patient has access to a qualified healthcare professional when and where they need one.
And is there a manpower shortage for healthcare professionals in the U.S., Erik?
Yes, there is, Rico. There sure is a shortage of healthcare professionals in the U.S.
By how much? By how many?
Some estimates have it to be greater than 250,000 nurses short in the U.S. A lot of that's driven by the aging population. And as you mentioned earlier about COVID, that's being compounded by a number of nurses leaving the profession due to stress and burnout from serving patients and being on the front lines for the last 2 years.
That is a huge manpower shortage, 250,000. And of course, everyone knows the Philippines has many very talented Filipino healthcare professionals who would like to work in America. What are the current career opportunities for them there, and which roles?
Yeah, Rico, great question. And you're absolutely right. The Philippine nurses are absolutely qualified to be of service in the U.S. They follow the exact same curriculum in nursing school that the U.S. nurses follow. And they serve in a variety of roles in essentially every single capacity in the healthcare system in the U.S., not only in the front lines, but we see many Filipino nurses serving in leadership positions and in the boardroom making, critical healthcare decisions at the hospitals in which they serve.
And is that why you are here in the Philippines? Are you recruiting Filipino nurses?
Yes, that's correct, Rico.
And what is basically the hiring process? I'm sure many of our Filipino healthcare professionals are watching us right now. Where and how do you recruit?
Yeah, sure. So, it's every international nurse that wants to pursue a nursing career in the U.S. needs to make sure that they've passed the U.S. nurse licensure exam, as well as an international English language proficiency exam. And those are really the two requirements needed to be a nurse in the U.S. And what we do at Health Carousel is we provide training and the opportunity for those nurses to pass those tests successfully to basically pursue that American dream and the opportunity to be a nurse in the U.S.
But we also know, Erik, that there's also a nurse shortage here in the Philippines. A lot of them want to work overseas, not only in the United States, but in Canada, in Singapore, in the UK, and in the Middle East. So how can you ensure the ethical recruitment of Filipino nurses?
So absolutely. So two things on that real quick, Rico. So one is, we feel it's really important, to invest, in nursing here in the Philippines. And as such, we've partnered with, leading universities and nursing schools such as St. Paul University, Baguio University, to name a few, where we're creating faculty scholarships here in the Philippines because we believe that's a means to a multiplier effect to create the next generation of nurses here in the Philippines. In addition to that, we've supported over 3,000 nurses in the last year and a half to help them successfully pass the Philippines nurse licensure exam.
So it's not just really a one-way street. It's a commitment indeed from Health Carousel. So it's just not a one-way street. It's a two-way street. You're also helping the Philippine educational system. So Erik, share with us, what benefits and initiatives will our Filipino nurses have when they arrive in the United States?
Well, the first thing that the experience doesn't start when they arrive in the U.S. It starts much earlier than arriving in the U.S., where we provide training and clinical preparation in terms of a transition to practice program. But when they do arrive in the U.S., we encourage them to arrive with their families. Families are critical, so we encourage them to arrive with their families, and they're greeted at the airport with a Health Carousel employee to make sure that not only the nurse, but also their families get acclimated to their local communities. They get their Social Security number. We help them secure their driver's license, not only temporary housing, but also assist in permanent housing, where their church is, as well as where their children should be enrolled in schools in their local communities. It's really about, Rico, the well-being of the healthcare professional, and that's just not the professional well-being. It's also their financial, social, and personal well-being.
It's a total package, Erik. And of course, you have a manpower shortage. How many healthcare professionals are you now recruiting in this trip of yours to the Philippines?
It'll probably be a couple hundred Filipino nurses, Rico.
And where will they be going? Which part of the United States?
Well, we serve hospitals and patients in all 50 states in the U.S. And what's important is that we want to make sure it's about making great matches. And one of the ways that you make great matches is understanding the preferences of our healthcare professionals. And, you know, some may come from a province in the Philippines and they want to be in a more rural community. Others in, Manila may want to pursue a nursing career in a larger city. And so we not only look at the preference of the healthcare professional in terms of geographic location, but equally as important is where they have friends and family. And we oftentimes find that's the biggest draw in terms of the community in which those nurses want to live and pursue a nursing career in the U.S.
Health Carousel COO Erik Schumann visiting Manila. Thank you so much for joining us.